Hello everyone, I am Dr. Mohammed Nishar, consultant plastic surgeon at Chennai Plastic Surgery. So in this video, I talk about lipedema. So this is a part 1 video of lipedema where I am going to talk in depth about what is the cause of lipedema, why this lipedema is misdiagnosed and how the women are affecting physically and emotionally because of this condition. Then in part 2 of lipedema, I will talk about the management. So let's start. What is lipedema? Lipedema is an abnormal fatty deposition occurring in hip, buttocks, thigh, leg and arms. This condition exclusively affects only women because of hormonal and genetic factors. Why this condition is rare? This condition is not actually rare. This condition is very common. More than millions of women are affected by lipedema all over the world. Then why it is not diagnosed properly? Because even the physicians and patients doesn't have any awareness about this condition. So when a patient of lipedema comes, they are always been misdiagnosed and misinterpreted as obesity, and they have been advised to follow diet and exercise to reduce this fat. But the biggest mistake is this fat does not respond to any kind of diet and exercise. I will explain further. When this lipedema occurs, what age it occurs? Lipedema starts during puberty, post-pregnancy and menopausal time. So these three are the stages where women notices lipedema features. Maybe in earlier stages, features of lipedema are subtle. It's not visible that much. But because of this, they are unnoticed. Over the period of time, the lipedema test features gradually increases and causes discomfort both physically and emotionally. What are the sufferings faced by these women? It's both cosmetic and also functional. It depends upon the age group which is affected. For example, in younger age group like 20 to 25 years, the appearance matters to them because the lipedema is in early stage. They can't able to wear the proper dress. They feel uncomfortable wearing the tight dresses. So they always wear very loose dresses to hide this abnormal fat deposition in their body. In case of older and middle-aged people, they feel very heavy in their legs. So their mobility is restricted. They also have pain. So it's more functional than the cosmetic appearance. So these are the struggles faced by them. What are the appearances or clinical features this lipedema shows? First thing is the abnormal deposition of the fat in the lower body, which is disproportionate to their upper body. Second thing is they have heaviness of the legs and thighs. Third thing, they easily get bruises. They don't have any injury, but they sometimes see their leg and thighs, they have small blood vessels which are dilated and they get bruises all over their body. So this is the third feature. Fourth thing is this fat will never respond to any kind of diet and exercise. Fifth thing is they have pain. When they touch, they feel very painful areas in their knee and thighs. So that's how the lipedema manifests. Sixth thing is their joint gets deformed because this condition is not only the fat, it's basically an inflammatory condition. So their joint also get affected. So they get joint problems very early stages of life. Sixth thing is they have a cuffing. What we say is their arm will be bulged and there is hooding of skin. So there is a cuffing occurring at the level of elbow, or sometimes the lipedema extends till their forearm and forms cuffing at the wrist level and also the ankle. Their hands and feet are never affected by lipedema. It looks normal, but other leg, thigh, hip and buttocks and arms will be enlarged. So your hands and feet will be the normal thing. So these are the clinical features of lipedema. If you have any of the clinical features which I have explained now, probability of lipedema you are having is high. So self-examine yourself. That is the key to awareness and proper treatment. Proper diagnosis is the key in the management of lipedema. Lipedema does not appear same for everyone. Each person has different stages. So I'm going to explain the stages of lipedema and types of lipedema. There are 3 stages of lipedema. In first stage, your leg seems to enlarge, but it appears normal to you. When you touch your skin, it appears very smooth. This is the stage 1. This is the early stage where young women are affected by this condition. So they don't have an awareness of having this lipedema. Then the stage 1 progresses gradually over the years to attain stage 2. In stage 2, you can able to feel the irregularity of the skin. Previously your skin was very smooth. Now you can able to feel the irregularities like bumps and pits, and your skin also will have multiple folds. So this is the stage 2. It occurs over the period of time. Then this stage 2, if not treated or managed properly, will go on to the next stage of stage 3, where you can able to feel nodules of fat deposits in particular areas in thighs and legs, and even there is excessive skin folds occurring in your lower body. So this is the stage. So stage 1 is your skin is very smooth, your thigh enlargement is not that much, but in stage 2 you can able to see the enlargement along with the nodularity when you feel your thigh. In stage 3, there will be a big nodules along with excessive skin folds. So these are the stages. There are 5 types of lipedema. So each individual has different types. Like type 1, there is a fat deposits in your hip and buttock region. In type 2, the deposition of fat extends from hip till knee joint. In type 3, the deposition extends from hip, thigh, knee, and also the legs are involved. Type 5 is little rare, where only your leg is involved, that is below knee region alone involved. So lipedema occurs in different stages and different types. One person's lipedema is not similar to other person. So don't compare yourself with others. Each patient's treatment and management differs based upon the stage and also the type. What is the reason for lipedema? This abnormal fat deposition, which I am repeatedly saying, it is not your fault. It's not because you are not doing exercise or dieting. It's because of genetics, hormonal, and other environmental factors also plays. Why hormonal? Estrogen plays an important role in lipedema. That's why lipedema is an exclusive disease of women. It is seen very rarely in men. Because of the role of estrogen, lipedema is aggravated during puberty, post-pregnancy, and post-menopause. So it's not your fault. Second thing is genetics. When we ask our patients who has lipedema, they always tell that their mother, sisters, their grandparents all have this similar kind of condition. So genetics plays an important role. Apart from this, what is the reason? Basically, this is not fat disorder. This is an inflammatory connective tissue disorder, where all your connective tissue structures like fat, blood vessels, nerves, and ligaments are affected. That's why there is an abnormal fatty deposition. There is an fragility of blood vessels, so you can get easily bruised. Third, because of the nerve involvement, there is a pain, and because of the ligament and joint involvement, you have a joint problem. So this is a systemic inflammatory condition. You cannot treat this condition with diet and exercise alone. So you need a personalized medical and surgical management. In lipedema, why there is an abnormal bulge? What is the basis behind this lipedematous condition? There is an inflammation happening in our body. This inflammation, for example, if you have a fever, there will be an inflammation. If you have an injury, there will be an inflammation. This inflammation is a short duration, but in lipedema, this inflammation is of longer duration. It is unstoppable. It won't stop on its own. That's why it is a continuous process. What happens in this inflammation? All inflammatory cells are coming and get deposited in your thigh and buttock and hip region. This causes fibrosis, what we call abnormal collagen deposition in and around the fat. So your regular fat is very soft, but lipedematous fat is very firm and nodular. Then because of the abnormal fat enlargement, your skin also loses its elasticity. At the same time, there is something called lymphatic system, where excess fluid is collected in this lymphatic system and circulated to your blood circulation. Because of this lipedema and inflammation, the pumping action of the lymphatic circulation is impaired. So along with this fat deposits, the lymph fluid also gets collected. The lymph fluid is a very nutritious fluid rich in protein. This helps in giving nutrition to this abnormal fats also. So it's a continuous and progressive disease. That's why Lipedema is not the fat alone, it also contains lymphatic fluids. So lipedema is exclusive condition of women and still it's a mystery. So lipedema is a condition where your lower body is disproportionate to your upper body, and this condition is always misdiagnosed and misinterpreted as obesity because sometimes this condition coexists with obesity. So right diagnosis is a key to proper management. All women with lipedema suffer both physically and emotionally. Because of their physical appearance, they are emotionally disturbed. They try lot of diet and exercise to get rid of this fat, but everything goes into vain because this fat does not respond to any mode of diet and exercises. So they get emotionally and physically disturbed. So it is not your fault. This lipedema is a genetic condition influenced by the hormonal and body inflammation. The proper management is the key. So in the next video of lipedema part 2, I am going to explain about the diet, exercises, medical and surgical management.